I'd like to cover one more thing, and this is sort of a pet peeve of mine or a pet project of mine, and that is the issue of how do we even get information in America? How does a surgeon, how do I find out what the right thing to do is? How do all these implants that I've shown develop at all? And it occurs mostly through a process called the peer review model. And this is based on an individual surgeon, say at the Mayo Clinic or Hopkins, deciding, volunteering and saying, I'm going to study this hip replacement. And I'm going to select my patients, and I'm going to study the effects of this surgery on them. And this is the only way that America works out, that American orthopedic surgical research works. And other subspecialties in medicine work this way too. Individual doctors have to take on the initiative to study a topic. Number two, individual patients have to sign consents. It has to pass through the institutional review board of every institution. So the patients themselves are kind of biased, self-selecting, and being willing to undergo the whole research process. The surgeons themselves are biased. Imagine doing an operation on 100 patients and then saying, boy, 50 of them didn't do that good. I think I'll publish that. It won't happen, can't happen. Same thing, a manufacturer is willing to support research funding and give you some funds if you're using his implant, but if you come up and say, that really isn't working very well, these implants are failing, yeah, he's going to do his best to eliminate it. At the end of doing your project, you put your paper together and you submit it to an editorial board. And who's on the editorial board? A bunch of other surgeons, basically, and of scientific journals. And they will look at your research, and you hope, and I think often they are unbiased and do select appropriate scientific criteria for publishing a paper. But we all have examples and experiences with editorial boards being kind of biased. They don't like your implant, they like their implant. And so there is inherent in this peer review model of research plenty of ways that there is bias. An alternative research technique is what is currently in force in Sweden, Great Britain, Canada, Australia. Ireland just started the legislation to institute a joint replacement registry. And a registry is just a big database, and it's incumbent upon a nationalized electronic medical record. In this institution, we're developing a medical record. Mike Hill is working hard on this. And then having it linked to a central site and a central server so that every single patient, who gets a hip replacement, or any operation for that matter, gets entered into the registry. The date of their operation, the surgeon who did it, the hospital who did it, the implants that were put in, the technique that was used, and then when the patient moves to Chicago, he's still in the database and he has to present to a surgeon in that site. He pulls up, bingo, this was a Zimmer implant and it's doing great at 12 years. Sweden has been doing this forever, and some of the best data on the longevity and the wear properties of joint replacements have come out of Sweden specifically because of this. Every patient who gets a joint replacement in any of these countries, bang, they're in the database. My academy, my group, the American Academy of Orthopedic Surgeons, is right now in the committee level of developing a joint registry. The biggest problem and the biggest resistance to this has to do with patient privacy, malpractice concerns. What happens if you're, we have an old saying in surgery, half of the surgeons are below average. By definition, half of you guys don't perform up to average. And more than half of the surgeons are anxious about that. Hospitals are anxious about this too. You can imagine a hospital saying, geez, we have a little higher complication rate, or we have a longer length of stay for our patients. So there's considerable resistance, though that does get in the way of capturing every patient, every data point, which would be so important. there are some opportunities for having a registry right now. Medicare has a national database, and all of the diagnostic codes are uniform, all the procedure codes are uniform, and we are starting to see data from big centers where the public health people are actually using the Medicare databases to find out complication rates and durability rates for joint replacements. TRICARE would be a natural, perfect, pre-made registry, because they have a limited group of covered lives, and they can track them no matter where they go in the country. They come back regularly, and yet TRICARE has been powerfully resistant to permitting any kind of clinical research to go through their database. I tried it. My partner, John McGuigan, tried. They are just very resistant to it. There is a bill right now that is in it that has been referred to the House Ways and Means Committee to establish a funding base to have a registry, specifically a joint replacement registry, and fund it and get it going. So I am very hopeful and very optimistic that this would be a big deal. It's not part of the Health Reform Act, but it should be, because this is the kind of reform that would be beneficial. This is not, the idea of having a registry isn't new. The National Cancer Institute and cancer centers already have a system whereby all patients are collected and data for all treatments for different types of cancers are collected. So a lot to think about, and if your hip is hurting, you got a lot of work in front of you for sure. You can search any of these topics and beware what you read. Churchill was pretty funny. He has more famous quotes about lying than anybody I can imagine. I mean, he has, all of you probably remember the lie, truth is, a lie is halfway around the world before truth gets its pants on, is another famous Churchill line. But certainly on the internet, it would be easy if everything on the internet was lies. You could just discount it. Unfortunately, it's not. There's a lot of good stuff on the internet and a lot of quality information. And so look and read with caution is how I would offer it.